Hi, I'm Dr. Bob Laskowski, and I live here in the Vineyard in Oak Bluffs, and I'm a volunteer with Healthy Aging Martha's Vineyard. And I know from the fact that you clicked on this video that you have some interest in advanced care planning. Now, I do too. In fact, I'm passionate about it. I want to share the reasons for my passion about advanced care planning and convince you that it's important for you to have a conversation about advanced care planning as well. As you know, I'm a physician and I'm a specialist in internal medicine and geriatrics. And about 15 years or so ago, I was doing teaching and administrative rounds at a big hospital in Wilmington, Delaware. My rounds took me to the trauma unit, and there I was rounding with the trauma team. We stopped at the bed of one young man who had had a terrible accident. He was in roughly his mid-30s, and he was in a coma. He had a respirator helping him to breathe and all types of tubes, and not in good shape. And from the conversation of the team that cared for him and from my looking at the chart, it became apparent that his prognosis was very poor. He was not going to make it. I also noticed, though, that there was a lot of stuff going on medically for this individual, Mr. Smith, we'll call him. And it wasn't clear to me, as a specialist in internal medicine, that anything was going to make a difference. So I turned to the head of the trauma team, my friend Glenn, a surgeon, and I said, Glenn, you know, it doesn't look very good here for Mr. Smith. What do you think? He says, no, Bob, the prognosis here is bad. He's not going to make it. And then I said, Glenn, I'm noticing we're doing a lot of things here, and I wonder if any of those are going to make much of a difference. And he shook his head with some sadness and said, no, you know, none of this stuff is really going to make a difference for him. So then I said, well, why are we doing that? And then a look of sadness came across his face, and I can feel a shiver go down my spine as I relate this story. And he looked back at me and said, you know, we have more than one tragedy here. Mr. Smith's not going to make it. Now, Mr. Smith has a family, and he's got a lot of family, actually, and they come in here a lot. But Mr. Smith never had a conversation with his family members about what mattered most to him in his life and what he would want if he ended up in a situation like this, or who should speak for him. And the family member, his large family, has very different opinions about what we should do. And so here we are. We have a tragedy on top of a tragedy. And the family's fighting with themselves, and now they're starting to fight with the staff as well, and it's ripping the staff apart. And Glenn shook his head. You know, I don't know what to do about it. I've been talking to our lawyers. I've got social workers involved. We've got to figure a way out of this mess. Sadly, that's not the only time I've had that experience as a physician. In fact, here on the Vineyard, if you go talk to the doctors at our hospital, you'll hear the same type of story. And in fact, this is true all across the United States. I went back and I talked to my wife, Kathy, and I said, you know, we should have a conversation. And I shared with her things that I thought most important in my life, and she did the same with me. And we made sure that we had selected people who we trusted to represent us if we couldn't speak for ourselves. And we made sure that we formalized this by having the appropriate forms completed and the wishes written down. That advanced care plan proved to be very important when my mom became ill. She had developed a terminal illness and eventually could not speak for herself. Fortunately, since we knew her wishes and she had someone designated to speak for her, and so we were able to focus on her needs in the last days of her life, and focus actually attention on ourselves, because when a family member is sick, seriously sick, it's not only the patient who suffers, but the entire family. It all starts with a conversation, though. The conversation. And people ask me, what's this conversation? It sounds kind of forbidding, you know, difficult. It's actually, the idea here is to make it easy, a natural part of thinking about what's important in life. And the first place to start with a conversation actually is the most obvious, and it's with ourselves. It's hard to have a conversation with somebody you want to represent you if you haven't figured out yourself what's important in your life. So that's something that actually you can do today. Now, what to do after that? Well, there are a couple other videos that my colleagues have that speak to some of the specifics, how to fill out a healthcare proxy, and to develop an advanced care plan, and I suggest you look at those. You can also participate in a workshop. Healthy Aging Martha's Vineyard has workshops, and people get together and they talk about the specifics of advanced care planning, and they tell their stories. And actually, you might find it surprising. People enjoy these, and they tell me they're fun because the humanness of us as people come through. So I'd recommend that as well. At the end of this video, there are a couple of slides that give you people to call and also other resources. They all travel the same ground there and end up in the same spot, although the style is a bit different, and some people like one versus the other. And we'll give you the information for all three. Most of the materials there are free. I've really enjoyed chatting with you today. I encourage you to begin your conversation today. I wish you good health. Take care.